ఇప్పుడు ఎవరు లేరు.
ఫుల్ స్క్రీన్ చేశారు కనిపించారు.
Here.
Hello.
Your live,
Hello?
sir. You can start now.
Yeah, okay. So, good afternoon, everyone. Today we are going to discuss pediatric obesity, the importance and the prevalence, and what are the consequences, and what is the awareness and activity needed at the level of the pediatricians and at the level of the school and parental level. We'll discuss brief in it and we'll go through it. So pediatric, let us have the introduction, definition, types and causes and complications, and when to see a pediatrician, and when to see the specialist, and what are the steps of management at each level, at the hospital, community, and the even at domestic levels. Okay. So obesity is a chronic disease. Okay, earlier obesity was used to like a variant of the normal physiological, but now it is considered as a chronic disease. There are ample of evidences and to say it is a chronic disease because it leads to many complications and morbidity as well as mortality. So obesity is a chronic disease characterized by excess or dysfunctional body fat, which impairs health, leading to long-term morbidity and even early mortality. So, so what are the prevalence? Is it really there so that the public and should be aware and active? Yes, the obesity is an rising trend and is rapidly increasing, even in developing and even in developing countries, even in the urban slums as well as rural populations. And this is alarming because we need to be aware of it, early identify, and manage accordingly. So when you look at the data, in infants, it is doubled in last 5 years compared to the National Family Survey 4 and 5. So, and it is up to 4.5% in the urban populations. This is in infants. When it's come to the developed countries like USA, it is highest like 16%. When it's come to the childhood and adolescence, so up to 40% all over the world in different geographic regions. So about 200 million children all over the world are obese right now. So in India, the latest meta-analysis suggests of this 16.3% from 2001 to 5 to 19.3% 2010 afterwards. Okay, so there is a 3% raise after the 2010. So it is on rising and increasing trend. The adult obesity, 1/3 of adult obese people, their obesity starts in the childhood, and the children which are obese in the early childhood have many complications and consequences. So, so right now the more than 14.5 million children are obese in India. So significantly increase after COVID restriction. In COVID times, there was decreased physical activity, decreased social interaction, which led to the increased screen time and increased eating behavior, and which led to the increased overweight, obesity, as well as complications of the obesity were also increased during this period, post-COVID period. And even in children, the complications are metabolic complications are being seen nowadays. So what is the importance of knowing this prevalence? The problem is rapidly increasing, and it is present in everywhere, like in urban and in the urban slums as well as in rural population as well. So it is very important to be aware of the problems by healthcare physicians, pediatricians, school authorities, national medical bodies, as well as policy makers to intervene the problem, so can it will be resolved or at least prevented from the complications. What are the types of obesity? So it is primary or exogenous. It is most 90% of the times. So good thing it is preventable. 90% of time it is primary or exogenous. It is due to the dietary lifestyle factors. And the other secondary causes or exogenous causes are endogenous causes are like endocrine, monogenic, syndromic, neurologic or hypothalamic, or drug induced, psychological, or some other miscellaneous causes. Okay. Let us look at the primary causes. So we can say obesity is a 90% of time it is exogenous or primary. So it is most of the time it is a dietary disease. You can say when you look at the factors of the primary obesity. So parental factor is one of the important. If one parent is obese, there is 40% chance of obesity in the child. If two parents are obese, it is 80% chance of the obesity in the child. When it's come to prenatal, maternal gestational diabetes, IUGR, excess weight gain during pregnancy, placental disruption, and maternal overnutrition, all this can lead to the overweight or obesity in the infant and child. Lifestyle factors like decreased physical activity, poor sleep, and excessive screen time can also lead to the obesity. Dietary factors like parental eating behavior, formula feeding, decreased breastfeeding, excessive quantity of processed foods, junk food, or carbonated or sweet beverages, and nocturnal snacking is also one of the important factors can lead to diabetes, obesity, and the consequences of it. So environmental mainly paucity of playgrounds, gardens, and which can lead to the decreased activity. Policy levels, excess availability of the high fat, high salt, high sugar foods, and that there needs to be the policy change which can control the processed food industry, where it can be reduced in the especially in school going children. Uh, so these are the causes of the exogenous primary, which is more than 90% of the cases. Most of these things are preventable in very few are uh, we cannot avoid, like parental obesity, but most of them can be avoided, and if you can prevent the obesity as well. So when it's come to other secondary causes, the little busy slide here, I have listed that at neurological causes, monogenic, and other genetic causes. So what are the complications? So we told that we discussed it is a obesity is a chronic disease. Okay, so disease had certain complications and the manifestation of the disease like this obesity can involve like endocrine immune system. It can have physical restrictions as well as psychological response to your body. Okay, when it's come to the endocrine immune response, it is due to the excessive adiposity, or you can say ectopic fat. So fat is in the obesity, excess fat is deposited in the like visceral fat, subcutaneous tissue, and in the organs like in liver, heart, intestine, and subcutaneous tissue. So this ectopic fat leads to the lipotoxicity. Okay, when so what are the lipotoxicity can lead to the complications like impaired glucose tolerance or impaired fasting glucose, and metabolic syndrome like hypertension, and so early puberty, delayed puberty, non-alcoholic fatty liver disease, and dyslipidemia, type 2 diabetes mellitus, and cardiovascular abnormalities there can be seen. Okay, what are the physical response due to excessive fat mass? Excessive fat mass in the intestine, like abdomen, visceral fat can lead to the abdominal fat can lead to the mechanical factors like so this mechanism. Suppose excessive fat in the abdomen can lead to the increased intra-abdominal pressure, which translates to the intragastric pressure, which can lead to the GERD. Okay, it can lead to decreased functional residual capacity of the lung, and can lead to the asthma, and it can lead to the tissue friction, and which can cause hypertension as well as other complications. Okay, when it's to the psychological response, the children with obese, they are isolated, and they are prone to the bullying in school, and they are prone to the decreased quality of life, decreased sleep, as well as anxiety and depression. So overall, this obesity has its endocrine, immune complex, as well as physiological and psychologicals. So it has sequelae which lead to decreased quality of life and mental disorders. So that's why it is very important to prevent the obesity complications and mortality and burden of disease is more than the undernutrition. So it is important for us to know these complications. So how to identify? We have seen all these complications. Okay, so how do what are the symptoms or children's when to identify early, then show to the nearby pediatricians or to the healthcare personnel. The symptoms you can see the system wise, you can see, or general symptoms you can see: nervousness, school absenteeism, okay, excessive fatigue, polyuria, polydipsia, polyphagia in case of the diabetes as a metabolic syndrome complications, headache, and local muscle tenderness, skin hyperpigmentation of the neck, and decrease excessive somnolence in the night, decrease sleep at night, and drowsy in the day. All these can be the symptoms which can suggest you the complications of the obesity. Okay, when are the symptoms of there are certain symptoms we can say the suggest a pathological cause or alarming symptoms like delay in growth, puberty development, and dysmorphic faces, hyperphagia, or early onset, the onset of obesity less than 5 years of age, or involvement of visual symptoms or hearing or neurological features. These children need to be referred to the multi-specialty and pediatric multi-specialty like pediatric endocrinologist, gastroenterologist, to look for the secondary causes and early treatment of the uh, condition in case of these alarm signs or symptoms. So whenever we identify the clinical symptoms and alarm signs related to the physicians or primary care physicians or pediatricians need to be evaluated the cause of the whether it is primary, secondary, and treat accordingly. So diagnosis majorly is a thoroughly and the history, physical examination, anthropometric measures, and laboratory evaluation. So history and physical examination gives clue to the many secondary causes, as well as history gives you the eating behavior, the portion size, whether child has nocturnal snacking behavior, or the we adolescents can have uh, eating disorders like bulimia and binge eating disorder. So and nocturnal eating disorder. This we can collect this information from the history itself. Physical examination can give clue to the secondary causes and also complications of the obesity like acanthosis, okay, excessive skin pigmentation, excessive hair and abnormal position, and gynecomastia. These can be examined at the physical examination. So physical examination should be performed thoroughly and in a stepwise manner. Most of the children or adolescents with obesity, they start wearing full clothes to to less expose their rashes or skin pigmentation. So we should be closely after informing the patient should be examined clearly. Sometimes you can miss the physical findings due to the excessive clothing. To make it less exposed, the children and adolescents they wear more clothes. Okay, the examination, one of the important factors is the anthropometric measures. So anthropometric measures should be there should be uh, uh, should be taken like height, weight, BMI, and in cases most waist circumference, as well as weight for length in children less than 5 years of age. Laboratory evaluation is helpful in looking at the complications of the obesity as well as the etiology of the secondary obesity complications like hypothyroidism, Cushing's in case of the syndromic cases. So how you diagnosis and anthropometry and basis. So diagnosis is an anthropometry basis. In infancy and children up to 5 years, we take weight for length and we use the WHO charts. Okay. When weight for length is more than +2 to +3 standard deviation, we label it as overweight. When weight for length is more than 3 standard deviation, we label it as obesity and WHO charts. Okay. When it comes to children above 5 years of age, like 5 to 18 years, we use BMI and we chart BMI on the IAP charts. Okay. When the BMI cutoff is more than the 23rd adult equivalent, we label them as overweight. And when BMI is more than the 27th adult equivalent, we label it as obesity. Okay. So this need to be seen. So because up to 5 years of children, we use weight for length, and after 5 years of age, we use BMI. Okay. And along with the BMI, we should also measure waist circumference. Waist circumference, this is very important. It indicates the cardiometabolic risk. Okay? The waist circumference indicates the visceral adiposity, and it is directly proportional to the metabolic syndrome as well as cardiovascular morbidity. So this is the best indicator of the metabolic syndrome, BMI and waist circumference. So this is the algorithm approach. So we have seen that history, physical examination, anthropometry, and laboratory evaluation. So we have to see the assess growth, puberty, onset. When there is normal growth, puberty, it must most of the time it is exogenous causes. So here we should only screen for the complications of the obesity. No need to evaluate endocrine causes for all endocrine like thyroid and everything. No need to look for them, because whenever there is delay in early onset development or delay in growth, so delay in growth, then only we should work up for the ATL, secondary causes of the obesity. So most of the endocrine causes they're associated with growth delay or short stature. Then only we should look for the endocrine workup. Now, otherwise, primary children, there is no need to unnecessarily evaluate for the thyroid and cortisol and just other investigation. We can avoid this investigation if there is no growth or normal or there is no short stature. In case of early onset, in obesity less than 5 years of children, or obesity with developmental delay, or obesity with dysmorphism, we have to look for the, if it is syndromic child, we have to look for the karyotype, like Prader-Willi and other syndromes. And if it is non-syndromic, look for the targeted gene panel for the causes of the monogenic causes of the obesity. So this simple algorithm gives you the utilization of the investigations. Okay. So when it's come to the management is most of the cases, as we discussed, it is a primary or exogenous, which is due to the most of the time it is dietary and physical activity factors. So the general principles of management are dietary management important, along with the physical activity and behavior therapy, and sequentially we can use pharmacotherapy and surgical bariatric surgery. Okay. In most of the time, we'll start with the dietary and physical activity, which is lifestyle management. Okay. Later, we can look for the behavioral therapy, and in very few in the obesity with complications, we can start with the pharmacotherapy or metabolic syndrome. And with children who are not improved or no response and the above 4, they can be referral for the bariatric surgery. So here this management is multidisciplinary management. Okay, dietitian should be there, and physical education teacher, pediatrician, endocrinologist, even psychologist when children who are not responding to simple dietary therapy, and surgeon can be involved later in the course as well. So it is in cases of not responding to the lifestyle modification, these children are referred to the multi-specialty, where the multidisciplinary approach to the weight reduction and management of the complications of obesity is required. See, this is dietary management. This is a overall normal reference, normal dietary intake from different age groups. This suggests of how many portions of each group should be taken. This is as a rough estimate, but it varies according to the ethnicity, geographic region, and uh, the family and customs. Okay. But when we are asking for the history, we should be able to know it is excessive. So that is, this is a reference to know whether it is excess or low in quantity. And this also helps us in looking at the whether the diet is balanced diet or not. Okay. So activity recommendations. Okay, activity is also important. So in children and like up to 5 years and children above 5 up to 5 years, we recommend them at least 3 hours of physical activity. It should be 1 hour of strenuous activity. Next 2 to 3 hours should be like moderate to vigorous activity. Okay, the activity level and here is given here, like running, jogging, hopping, jumping, okay, push-ups, and okay, continuous sports, and these are the uh, grading of the activity. Okay, from moderate to vigorous activity. So children below in so at least 1 hour of vigorous activity, 2 to 3 hours of moderate to vigorous activity is same. Okay. Along with physical activity, we should also look for the screen time as well. So in children below 2 years of age, there should be zero screen time. In children 5 to 12 years of age, the screen time should be less than 2 hours. Okay, and after that, the screen time should be as much as minimal. Okay, recommend 2 hours only. There are, when children doesn't respond to the dietary and physical activity and behavioral therapy, or children with obesity with a metabolic complication, they can started an pharmacotherapy at specialist center. So these are the available few drugs for pharmacotherapy in children. So most of them are available only in children above 12 years of age. And like metformin is a FDA approval about 8 years of age, and most of them are available about 12 years of age. And there the complications are high complications. They should be monitored closely, and along with the weight loss should be monitored. If there is no weight loss, the pharmaceutical drugs should be stopped after 8 weeks, and should be look for the alternate medications. So if this is the final step, when the child is not responding after all other measures, the child can be looked for the. However, this most of the surgeries are only in adolescents, not in children, because they have complication. Then strict appetite control, good dietary control, and physical activity. It should be performed only multidisciplinary facility with close monitoring. These are the different surgical options available, like restrictive surgeries where satiety is early observed, like gastric banding, sleeve gastrectomy, gastric balloon inflation, gastric balloon inflation. Malabsorptive passage like biliopancreatic diversion, jejunal bypass. There are mixed surgeries like Roux-en-Y gastric bypass, BPD with duodenal switch. Okay. Gastric balloon is nevertheless endoscopically uh, inflated and kept in the stomach, so it causes early satiety and decreased food intake. However, satisfaction is low. Some patients can have vomiting. So nevertheless, they can be used in adolescents where children are not responding any of the above therapies. So this is overall management of the infants. Infants is the dietary intake, activity, okay, and behavior and sleep important. These tips are important. Most of the children respond to this. So food intake, it should be rather the food should not be restricted much. Rather, we should have healthy eating habit, like uh, meal patterns. So diet is important. So most of the time Indian diet or is good, and only thing we have to control the meal portion size, the balanced diet which include all components of the diet, and there should be the behavior should be changed. Sometimes Children can be overeating while watching TV or when they are excessive crying. Those eating behaviors should be modified. They should be encouraged for physical activity like taking to the nearby garden and under and indoor games, as well as they should be taken care of the behaviors. So when it's come to the children, along with the intake, activity, behavior, there is also pharmacotherapy depending on the metabolic complications. Yeah, in very few cases there can be bariatric surgeries as well. The overall algorithm for the and approach to the obesity and overweight. So when there is overweight, so preventive plus, as we saw, lifestyle modification, diet plus physical activity. If there is a response, good response like maintaining weight or decrease in BMI, and there are no complication, then continue same thing. Okay, if there are complication anytime or no improvement, then we have to advance to the structural weight management program, where there is multidisciplinary team is involved along with pediatric gastroenterologist, pediatric endocrinologist, physical activity psychologist, and dietitian as well. There should be structural weight management program should be enrolled and should be continued, and there is improvement and then continue. There is no improvement, you can further involve the other therapies and aggressively upgrade the pharmacotherapies as well. Okay, so in case of severe obesity, again look for the lifestyle modification. If there is a response, then okay. If no response, go for structural weight management, or no improvement, there is comprehensive medical intervention therapies. Okay, this overall management. So in nowadays, so what is important for parents and healthcare, other allied healthcare professionals, or school health authorities, is the prevention. There is the parents should set the role model for children regarding eating behavior and quantity of eating, the type of diet, and so and the American Academy of Pediatrics have the prevention strategy suggest, yeah, there should be at least 5 or more servings of the vegetables or fruits per week, and less than 2 hours of screening time per day, and at least 1 hour of strenuous activity per day, and zero sweetened beverages per day, or high salt, high sugar foods per day. So this can helpful in the prevention of the obesity in children and adolescent, and further by decreasing the complications. So this is the overall discussion on obesity. Um, I think it helpful for the pediatricians and healthcare professionals, and even for the parents and other school health public as well. Thank you. Yeah, I'll be answering the comments here. Uh, so, what are the solutions to childhood obesity? Okay, solutions as we have discussed. So, first was dietary therapy, followed by physical activity, behavioral therapy, where we control the eating behaviors, and as well as pharmacotherapy and surgical therapies. Okay, most of the children, they improve with the lifestyle medical nutrition like dietary therapy and physical activity and behavior therapy. Behavior therapy needs in at least in the second time when they do not respond to the diet and physical activity, because sometimes diet is consumed as a cope up, like during the excess anxious times or depression or during the celebrations. So the diet should not be consumed for the like leisure periods or just for the sake of the comfort or happiness. So this is also important. These three, the diet, physical activity, behavior therapy, is sufficient in most of the children, but need to be closely monitored. Rather than some intervention, it should be made like a uh, inculcation of a new habit into the life of the child. What can parents do to reduce childhood obesity? Yeah, parents, yeah, we know the causes. 90% of the time, 90% of the time, the obesity is primary or exogenous. So it is most of the dietary and physical activity related. So here parents should set a role model for child regarding eating behavior. Okay, so like we should avoid nighttime eating and should avoid overeating, and during we should avoid excess eating during anxiety, depression, or excess celebration for eating. And as well as parents should set the role model as far as the meal portions as well as balanced diet portion as well. Parents should avoid excessive processed foods and cold beverages to set right. These are the what parents can do to reduce the child abuse. At the same time, parents should also set role model for the physical activity. The parents should be having should be have physical activity of at least 3 hours per day, like 1 hour of strenuous activity and 2 to 3 or 2 hours of moderate vigorous activity. So and parents, children can be taken along with them. At the same time, screen time. So other than academic screen time, they should be minimalized less than 2 hours. Non-academic screen time should be less than 2 hours, and at home that there should be no or minimalized screen time, including the screen time includes mobile, tablets as well as TV and movie watching everything. What are the some remedies to prevent obesity? So prevention as simply we so like 5210, the simplest strategy we can say like at least five or more servings of vegetables and fruits per week. Okay, and at less than 2 hours of screen activity per day, at least 1 hour of strenuous activity per day, and zero sugars or salt and sweetened beverages and other cold beverages we should be avoiding. So again, their children. So, hello doctor. Suggest a few tips for parents to help their children maintain a healthy weight. Now, as we discussed, it's a physical activity, dietary, screen time, sleep, and the feeding behaviors. These are the things to be taken care of. Mm. Are there any effective medicines for treating childhood obesity? Yeah, most of the medicines are available in children about 12 years of age. There are medicines, and there can be prescribed in a closely monitored environment, and also looking for the response to the therapy. So there are medicines. Yeah, they can be taken mm, in the multi-specialty center. So, what are the dietary changes should we make at home to help manage my child's weight? Okay. So, when it's come to the dietary changes, okay. So, what are the changes, exact changes we need to do? So, the first principle is avoid the excess non-nutrient snackings which are not useful. Okay, which are not nutrients. Number two, you should be using the balanced diet. Okay, balanced diet means uh, at least there should be one milk component, one cereal, one pearls, along with vegetables and some added fat. Okay, and at least one fruit among these seven components like milk, cereal, pulses, vegetable, fruits, and fats. Among these, at least four should be there in at any time of the meal. Okay, And when it's come to the balanced diet, so no need to severely restrict. So most of the time what mistakes we do, we severely restrict the diet. We allow only one time or two times, and which can lead to compensatory excessive feeding, which is not good. So there should be, you can have three times of meal or two times of meal along with calorie deficit. There should be calorie deficit. Excessive consumption should not be there. It should be, we should just satisfy your hunger, and which leads to the, it should be there in case of overweight or obese children. There should be 500 kilocalories of deficit per day, and which lead to the gradual weight loss. Okay. Along, so first principle at so balance diet and calorie deficit, followed by physical activity. These are the things so which need to be taken care at home. So simple, there is my plate strategy. So in my plate strategy, especially can be done in children with adolescents. In my plate strategy, when it's come to the diet, simply say half of the plate should be with the like snacks, like salads, okay, like carrot, beetroot, or watermelon. Half of the plate should be salads. Next half of the plate should fill with cereals, pulses, and vegetables. So which can helpful in the day-to-day and obesity management. But children which are obesity, after a trial at home, don't necessarily, don't, if there is no response, they should consult the dietitian or pediatrician nearby for further management. So another question is, are there any underlying medical conditions that should be contributing to the child's weight gain? Yes, there are medical conditions. There are only there, but overall, when you look at the number of the obesity, there are only less than 10% of the cases. The underlying medical conditions can be like endocrine causes, hypothyroidism, Cushing's, and others are drug induced, some anti-epileptic doses, glucocorticoid due to any inflammatory conditions, or antipsychotic, anticonvulsant can also cause obesity. Others are neurological causes like hypothalamic, or after hypothalamic diseases or after the trauma there can be excessive weight gain. Or there can be psychological causes, excessive depression, anxiety can lead to the overconsumption of the food to cope up the anxiety or depression, can lead to the uh, weight gain as well. So there are secondary causes like endocrine, neurological. There are also genetic causes which can do the mutation of the uh, like leptin deficiency, melanocortin receptors. So this can, there are genetic causes as well, but these contribute to less than 10% of the cases. So next question, how much physical activity should a child be getting and what types of exercise are the most beneficial? So there are many guidelines, first from the Canada to the UK and Australia and USA guidelines. In preschool children, like 3 to 5 years age children, there should be at least 3 hours of physical activity, from lateral movement to the vertical movement and to the walking. So all those should contribute at least 3 hours of physical activity. Among these 3 hours, 1 hour should be some strenuous activity, rapidly moving hands, playing with games, or rapidly walking, jogging. 1 hour should be the strenuous activity. So we'll take it as 3 hours of physical activity. 1 hour is strenuous. 2 hours is the moderate to or mild to moderate physical activity. So along with physical activity, we need to be taking care of the screen time as well. So whenever we talk about physical activity, you should take care of the screen activity as well. So what type of physical activity, types of physical activities can be simply, yeah, simply running, jogging, hopping, or playing with, these are the like aerobic, or you can say severe activities. Others can be indoor game, playing with the, like, simply uh, playing with the toys, or running here and there at home, being active and involved in the small activities at home. This can be the mild to moderate activities. I think there are no questions, no more questions. We'll conclude the session here. Thank you everyone for patient listening and being involved in the activity as well. Thank you everyone. I'll close the session now.